Clinical trials are essential to advancing healthcare by historically women, especially women of color, have been underrepresented in cardiovascular research. Now, it is essential to have diverse representation in cardiovascular trials to ensure heart disease is accurately understood and effectively treated. Today, we're speaking with Dr. Roxana Miran from Mount Sinai Health System, who will tell us more about the clinical trial process and how you can participate in local clinical trials, including Librexia, a comprehensive clinical program covering a number of cardiovascular diseases. Thank you for joining us, Doctor. How are you?
Thank you so much for having me. I'm doing great. Thanks.
Now, what are clinical trials and why are they important, especially for women and people of color?
Well, thank you for that really important question because clinical trials is how we learn about drugs and devices and how they're working in the population. And that's how drugs and devices get approved through the FDA in the United States particular. And so it's very, very important that the trials are representative of the patients that we're treating every day in our practice. You know, heart disease in women is the #1 killer of women. And yet they're so underrepresented in clinical trials. And so it's very, very important that we learn about the safety and efficacy of new drugs and devices by having them in our trials. But so is this really important to make sure that people of color who have been previously not coming into the clinical trials for various reasons be included. So we want you as women and people of color to learn more about these trials. Make sure that you are at least getting some information and that if you are a candidate and you fit in, why not participate so that you could also be part of solving the problem of the heart disease is the #1 killer of men and women across the globe. I think it's so important to be part of these clinical trials. The Librexia program is just one of many.
Well, speaking of which, tell us about the Librexia program and what health conditions are being studied as part of the trial.
Well, the Librexia program is incredibly comprehensive, right? They're going to enroll about 50,000 patients with 3 different conditions. One is atrial fibrillation, which is an abnormal, irregular heart rhythm that predisposes you to stroke. About a quarter of strokes that we see are due to atrial fibrillation. Or the second one is in the stroke patient population. If you present with a stroke, you could be a candidate for this study. And then heart attacks, acute coronary syndromes or ACS. If those are some of the conditions, these 3 conditions are incredible contributors to ischemic heart disease and why patients are dying of heart disease. So very important that we get diverse patient populations in these trials.
Speaking of which, can you talk about the importance of diversity in clinical trials?
Yeah, as I said, I mean, I think if we end up with a very selected population and our device or drug gets approved on a select patient population that's mostly males or whites, then how am I, as a doctor, supposed to say, is this going to work in women? Is this going to work in a person of color? And I think it's going to be really important to make sure that our clinical trials are diverse. That's one way of really getting to the bottom of what's happening with heart disease in our population. So diversity matters a lot. It matters everywhere. We're just much better when we're diverse.
Now, doctor, can you explain the clinical trial process and what can participants expect when they enroll in a clinical trial?
Well, they will be given a lot of information. There's all kinds of processes. Ask questions, make sure you know everything about the trial and feel comfortable with the answers you're being given. And of course, then it's your right to be in there. And then once you're in, you're going to get phone calls, you're going to come in. They're going to be watching out for any complication that might be arising. And then that's really the final expectation. And once the trial comes out, you could feel proud that, Well, I was part of that, and I was able to answer that. I was part of that, answering that question. And I think that's another really great thing about being part of a clinical trial.
Now, if someone is interested in joining a clinical trial, how can they enroll?
Well, there's a website that has been set up. It's called researchincludesme.com. And that website will give you a very good comprehensive information about how you can get to a Librexia program near you, because there's over 700 or 800 hospitals around the country who are participating in these trials.
One more time, where can our viewers go for more information?
Researchincludesme.com. That should be easy. Researchincludesme.com.
I like that. Thank you for joining us on Morning Blend, Doctor. Thank you so much.
Thank you so much for including this on your program.
All right.